But if somebody is actively in therapy and they are doing the hard work in therapy, that's where the stellate ganglion block can really provide some longer lasting treatments. The number of treatments that a patient needs and the length of time that a stellate ganglion will last is largely dependent on everything outside of the stellate ganglion block. So what I mean by that is the patients who come and we do a stellate ganglion block on them and they are not in therapy, they're not seeing a counselor, they're not trying to actively work on the deeper root cause of their anxiety, their depression, their PTSD, all of those things. Those patients, this is simply a Band-Aid treatment. You will feel better for anywhere from 4 to 12 weeks. It will wear off and then you will want to do it again. And it will repeat over and over and over for years, because while there is some research showing that there are some epigenetic changes that are occurring in the stellate ganglion when we do these stellate ganglion blocks, 98% of people that doesn't really play out clinically a whole lot, meaning we can't just do a whole bunch of these over a 5-year period and cure you of any childhood traumas, any traumas in your adulthood, like whatever it is that, is contributing to somebody's mental state or mental condition. It's not going to resolve those things and make those things go away. But if somebody is actively in therapy and they are doing the hard work in therapy, that's where the stellate ganglion block can really provide some longer lasting treatments, because the stellate ganglion block essentially allows you to dig deeper in those therapy sessions. It allows you to address some of the things that your subconscious and your unconscious mind are protecting you from because of whatever trauma, whatever incident, whatever it is that's going on that's contributing to the deeper root cause of these symptoms. And so those patients, we might need to only do, within the first 12 months, we might do 2 or 3 procedures total, depending on the severity initially of symptoms. We will sometimes front load and do 2 procedures kind of more back to back. And then the patients who are doing the work can sometimes see upwards of 6 months of improvement. And then that starts to wear off. And then we repeat another injection. They might get another 6 months. And so that's really what I think makes or breaks this procedure. Think of it like this. If you've got really, 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 really bad knee pain and you need to do physical therapy, but you can't do physical therapy because your knee hurts way too much, then sometimes an anti-inflammatory medication like ibuprofen is helpful because it allows you to do the physical therapy to get stronger so that your knee doesn't hurt. This is the exact same thing, but for the mind, right? If you just take ibuprofen for your knee pain, guess what? That's not going to cure your knee pain. It's just going to numb it out for 8 hours and then it comes right back. Same thing with the stellate ganglion. The stellate ganglion will just dampen the nervous system's response to your triggers and your stressors and things like that for a period of time, and then that comes right back online. If you're not doing the underlying things to help address why that stuff is there in the first place, then it'll just keep coming back. But if you are at a place where you're addressing it, then you can see really good benefits from it.